So hello and welcome to NEMA's Virtual Learning Lab. I'm Jessica Bursky, NEMA's Senior Policy Analyst, and we're excited to host this opportunity. And now it is my pleasure to introduce our National Emergency Management Association Executive Director, Trina Sheets.
Thank you, Jessica. That was very dramatic. Hey, everybody. Good afternoon, and thanks so much for joining us. Want to say hi to all of our NEMA colleagues, our old friends, and even new acquaintances if this is the first opportunity you've had to engage with NEMA. Just want to say thank you so much for being part of our virtual Learning Lab series, which kicks off today. You know, over the past year, we've all had to reinvent how we bring people together for meetings, training, and professional development, and NEMA is no different. We held our first virtual summit back in September with lots of positive feedback, so we thought, let's give it another shot. We're back again, trying something just a little bit different this time. In light of the fact that we weren't able to bring all of our members together in person for the mid-year forum, as we usually do at this time of year, NEMA reached out to our private sector partners to bring you a series of conversations on issues of importance to our community. And I say conversations intentionally because we want this series to be as interactive as possible. As you know, that's where the real value lies, when we can share our different thoughts and ideas and learn from each other, even in a virtual environment. So please engage with us. The Learning Lab series is just jam-packed with the latest information from some experts that you won't hear elsewhere. And I want to thank all of our wonderful private sector partners who are so generously supporting this event, not only financially, but through their expertise and experience. We all look forward to hosting you all on Tuesday and Thursday afternoons during the month of March. It's so nice to be able to connect with each other in whatever way we can right now, while also keeping the faith that we're going to be together in person, hopefully sometime later this year. So now it's my honor to introduce the NEMA President. Live on your computer screen is Sima Merrick, Director of the Ohio Emergency Management Agency. Sima.
Thanks, Trina. And that too is very dramatic, and I love every second of it. So hi, everybody. Good afternoon. And thanks for joining us for the very first webinar of the NEMA Learning Lab series. This is just an awesome opportunity for all of us. First of all, to see everybody, you know, in a time where we're probably all yearning to be together. I just said to Trina the other day, this is the second year, really my third, because I was sick a couple years ago, but the third year that we haven't been together at the mid-year. And the mid-year is actually my favorite gathering because it's where we can all relax. We're comfortable there. We get a lot of work done. We get to be with our sponsors and our partners, which is incredibly important to the emergency management family and network. You know, I want to express my sincere thanks to our sponsors for making this event possible. Those sponsors are ICF, Haggerty Consulting, Harbor Industries, Guidehouse, IEM, Buffalo Computer Graphics, FirstNet, AT&T, and today's host, AECOM. You know, I mentioned normally we would hold its mid-year in March in the DC area. And because of the pandemic, we continue to have to keep canceling. It's extremely disappointing. And I hope and trust that we'll be together in person next March for the 2022 meeting. I'll be incredibly disappointed if we're not. In the meantime, NEMA is pleased to offer the learning opportunity throughout the month of March in partnership with our fantastic sponsors. At all levels of government, we depend on our private sector partners for their expertise on a daily basis. And I'll tell you real quick, in Ohio, we, at the early rollout of PPE, we wouldn't have been able to do the things that we did for all Ohioans and even across the country if we didn't have those strong public-private partnerships and to be able to rely on the relationships that we have built with all of you through our membership at NEMA and being to hang out, not only for all of the learning experiences, but the downtimes where we have our after hours events. So, you know, who better to learn from on a number of very timely and important topics that are featured each week in the Learning Lab. I'd like to emphasize that you won't be hearing a sales pitch from any of our webinar sponsors, just voices of knowledge and experience. As part of the Learning Lab, we have also planned that social networking on Thursday evenings at 7 p.m. That's Eastern time, with relaxing and fun events like a wine tasting, magic show, yoga, and a competitive game of psych, which sounds very interesting. I hope you'll join me for some much needed downtime with NEMA friends. With that, you know, in closing, it's let's have a great month of virtual learning and networking. And at this point, I'd like to turn the webinar over to John Dorman, Vice President and Director of Emergency Management and Risk Management with AECOM. John, thanks again for all that you do and for your support.
Well, thank you, Simba. And I want to thank also NEMA for hosting these virtual learning labs. Just in my prior role, I was the EM Risk Management Chief in North Carolina and greatly appreciated the role that NEMA played in learning and sharing amongst all of those other practitioners towards protecting life and property. So thank you so much for that. Welcome, everybody. I hope you're having a great day. I think this is going to be a great session. The purpose for this session is really to talk about experiences and lessons that have been learned and are being learned with regards to the community lifelines and how they're being impacted by COVID. So just, I don't believe any of us, I don't think anyone would have ever imagined that the extent and the impact that COVID has had on life, on health, on safety, on the economy, relationships. I believe we have all been impacted by COVID. These impacts are not just personal, but they also greatly impact the public sector and the private sector. And so really the goal for today's discussion is really to share, leverage, learn from each other on a couple things. One, how COVID is and has been impacting your community lifelines. We need to discuss that, but also what best practices and innovations may have been implemented that can help all of us reduce that impact and thus make us more resilient towards this hazard that has truly brought us to our knees. So really on the outline of the session, I'm going to introduce this fabulous set of panelists. I'll give you a real quick snapshot of the COVID impacts at the present time. Then we'll hear from the panelists, which will be gold here, but we'll hear from the panelists on their perspectives, their lessons learned, and then best practices that they and their state have implemented. And then we'll go through a question and answer session as well. So let me just go ahead and introduce the panelists that will be talking today, and then we'll have them discuss shortly. Let me start with Abby Brown. Abby is the Chief of the Office of Private Sector and Non-Government Organization Coordination with the California Governor's Office of Emergency Management. Abby's responsible for developing and maintaining emergency service relationships with businesses, associations, companies, universities, as well as nonprofits, non-governmental and philanthropic organizations. So she's pulling them all together. But let me also introduce Allegra. Allegra is the private sector liaison and preparedness specialist with the Maryland Emergency Management Agency. In her role, she leads the private sector integration program that's within the community and outreach branch. Allegra ensures that Maryland's private sector businesses are also prepared through emergency planning, response, and recovery. Then we have Kyle Oberly. Kyle's a man after my own heart, Kyle. He's the Director of Disaster Risk Reduction with the Maryland Emergency Management Agency as well. Kyle leads 5 of the branches and programs, which include hazard mitigation, risk analysis and recovery, public assistance, community and outreach, and the non-government sector. And then last but not least, we have Persia Payne Hurley. Persia is the branch manager for the North Carolina Business Emergency Operations Center. She was actually the creator and developer of this center, which was the very first one in the country. She's also administered the North Carolina Vendor Disaster Reentry Program, which is the very first one in the country as well. Just to share, the North Carolina Business Emergency Operations Center currently has over 1,000 corporate and business partners that are integrated as resources with the Emergency Operations Center. So that has a very strong, powerful capability. So looking forward to listening and hearing from each of those. But let me first just talk a little bit about the snapshots that we're currently going through right now. So as we know, first and foremost is going to be what we do in preserving life with regards to this COVID situation. At the present time, there's about 28.4 million confirmed cases. Unfortunately, there have been deaths over 500,000, and so we certainly mourn that. We're hoping and looking to see that these numbers continue to come down. With regards to COVID vaccines, we're seeing a great increase in the trend of vaccines being delivered and administered. The vaccine rollout strategies are being implemented at all levels of government to ensure timely, effective, and equitable distribution of those vaccines. Delivered about 96.4 million and administered a little over 76.8 million. So we're continuing to watch that and are very hopeful that that will increase. So as I mentioned before, while the primary focus of EM is certainly on the preservation of life being impacted by COVID, there are other fundamental services that are critical to the stability of communities and in society. These are broadly called community lifelines. FEMA has established this. But as you can see on this slide, many of those are broken down actually into further and further essential functions. Each of these essential functions and the more specific ones all have been impacted by COVID, and some severely, some mildly, but all of them have been touched. So what we'll do is we'll go into a few of those. I'll share that, and then we'll get back with the panelists. So just wanted to touch, I don't think this is one that any of us have any doubt has been impacted, certainly. And so hospitals and hospitalization of COVID patients have been severely impacted, and the ability for hospitals to actually treat other medical patients as it would have been able to do in normal times. As you can see on this slide, there was a significant increase. January 11th of this current year reflects the highest number of COVID-19 patients hospitalized across the country, which is about 124,000 patients. So that is a significant number. So in the field of transportation, transportation in each of the multimodal sectors have also seen a significant impact due to restrictions from COVID, as well as the fear of getting the vaccine. Commuting has significantly gone down in the workplace by about 31% is what it is at present. At its worst point, it was about 95% reduction of going to the workplace. You can see 25% reduction at the present time for retail and recreation. You can also see mass transit at a negative of 31%. So this is also another area where significant impacts are being seen. Probably the one that we know the most is in the aviation area. And you can see there was a dramatic drop immediately after COVID over this last year, approximately 52.4% decline over the year's time associated with aviation passengers. So the transportation area has certainly seen its impacts. Food, water, and shelter are significantly impacted as well. Through the course of the pandemic, you can see that food insecurities has significantly increased. You can see that 9 states at the present time have a food insecurity that is 20% or more of the population. 12 states are in the 18 to 20 range. 17 states are in the 16 to 17 range. 7 are between 14 and 15, and only 5 are below 14%. I think the point here to make is food supply chain, food distribution, spoilage of food because of no transport is significantly impacting the food, water, and shelter. And just to give a global understanding, you can see up here that on the top right, that between last year and the present time, there's been a 96% increase in the acute food insecurities globally. So that's a significant statistic. And then the final one, just to share, and I think we all have children or grandchildren or friends who are in school. You can see that there's been a dramatic drop because school closures, because of the concern of COVID. 124,000 students, schools have been closed. 55.1 million students have been impacted. And this also has impacted in the higher education branch as well, where about 4,200 higher education institutions have also closed or gone virtual, with about 25.8 million that have been impacted. So just a couple different areas of lifelines and essential functions that have been impacted significantly. And there are many more of these. But what I would like to do is, at this point in time, is I'd like to go to the panelists and let them share. We asked each of the panelists, would they please share with us a little bit about some of these questions. The first one was, what are the top 3 lifelines most impacted? The second one was, what is the most difficult lifeline to alleviate? The third question was, what population in your state is being impacted the most? And what are the efforts to resolve that? Fourth was, were there any best practices that you may have implemented that have helped to reduce these impacts? And then finally, do you actually have the resources that are necessary to respond? Because this came out of the blue, and I know states are working to respond to these with the existing resources. So with that being said, I'd like to go to the panelists, and if possible, Abby, would you mind starting? And then we'll have Allegra, then Kyle, and then Persia.
Sure, I'm happy to start. So the top 3 lifelines that were affected, number 1, obviously, is healthcare. The healthcare industry was significantly affected during, and still is during COVID, as we move along. Then I would say the education industry, just because of the shutdown, and then trying to facilitate virtual learning. And despite being California, not everybody in California has internet access, or at least high-speed internet access, and trying to make education equitable across the board for all of our students. And then finally, I'd say a tie for the third would be, pretty much all the other industries. I mean, COVID really affected all of it. It has been quite a shift in mentality for all of our sectors on how to adjust to the new normal, if you will. Tourism is a very large industry in California, and that's been affected greatly because of the disaster. And then of course, all of the food issues. We have in California, we have a large agricultural industry that was affected because of the population and the workforce being sick. And so that was another thing. So those were the top ones that I can think of that just really stand out. Working with the healthcare sector, you had asked what did we do to fix it, or can we fix it, or did we have the resources to fix it? We poured everything we had into fixing it because we recognized right away, especially with projections and things that we were expecting to come down the pike, that we just weren't going to have enough hospital room. So we worked with, and I'm sure you all remember the ventilator rush, the great ventilator rush, and how everybody looked for that. We worked through our different manufacturing ideas, tried to bring online marketplaces for folks in California that manufactured PPE to be able to sell PPE quickly and smoothly to other California businesses as well as the rest of the country. And then we boosted up our alternative care sites. We set up several field hospitals throughout California, as well as we purchased a few buildings that were hospitals, and we staffed them up and we made them hospitals. And so we just added and added and added. The issue then became staffing. And so we worked on the staffing of those hospitals as far as the training goes for additional nurses. We have a health corps volunteer team. We have different avenues to get different staffing for the solution. And then finally, the last thing we wanted to do was pull staffing from our other states, our sister states, because that was part of the biggest issue with this disaster is normally in a disaster, California is hit and we can pull resources from our sister states. Everyone is always very eager to assist and help. And just like we are when there's a disaster in another state, in this situation, everybody was hit. EMAC was kind of like non-existent because everybody needed all of their folks. It was the same thing for our nursing and hospital staff. And so we actually started looking at working with some of our country friends like Australia, who had a different timeline for the disaster. So I think I answered your questions. I'm not exactly sure, but if there's more, I'm happy to go into it, especially with the education sector. We worked very closely with our private sector partners, Google, Microsoft, any kind, Apple, of course, don't forget Apple, getting Chromebooks and getting iPads and getting computers and being able to distribute them to the students, as well as coming up with fancy solutions for Wi-Fi. We put Wi-Fi hotspots on school buses and drove them around in areas to try to get internet access for these students. So that was another creative solution we had.
Well, Abby, let me just ask you before we go to Allegra. Do you feel like you have the resources that you need at this point?
Well, that was what was interesting. So we are California, and if the resources exist, we will buy it. I mean, we will do what we can to put the money to where it needs to go. We got creative with our resources. Let's put it that way, because all the money in the world can't buy something that doesn't exist. And so we, like with the ventilator situation, we got creative. We figured out, okay, well, we put some of our greatest minds on it, from Apple, Google, Boeing, Northrop Grumman, and then the one company, oh my gosh, I'm forgetting the name of it, you know, that they go to space. Anyway, they all got together, and it was really cool because I got to coordinate with our schools, our universities, to think about, okay, well, let's figure out a way to make a ventilator work for 2 patients instead of 1 patient. I mean, they were innovating as we speak. And because of my role being able to coordinate all of that, I was included in all of those jam sessions, if you will, where they were thinking out loud. And a lot of the lines that normally will stop people from working together went away real fast. And everyone just, Virgin Atlantic, that was it, Virgin. They were the one, Virgin Orbit, they led the pack. But it was really cool to see how that went. So where we didn't have the resources, we figured out a way to get alternative resources.
Right. Fantastic. Thank you. Okay, Allegra.
Well, thank you so much again for this opportunity and to speak to all 157 of you today. This is such a great honor. And if we are not seeing each other in person, this is better than that, because at least we are connecting across the nation in different time zones, and we're still having a collaborative discussion and problem solving. I want to first defer an overview of these questions to my Director of Disaster Risk Reduction, Kyle Overly, and then I will provide more in-depth examples of how the Maryland Business Emergency Operations Center acted under the Non-Governmental Services State Coordinating Function Unit. So I'd like to now pass it on to Kyle Overly.
Thanks, Allegra, and sorry for the change, but I think we in Maryland really experienced similar challenges to what Abby did over there in California. The first question, which are the top 3 lifelines that were impacted the greatest? That's a tough question, because this was a situation where all lifelines were affected in different ways. And the easier question probably to answer is what wasn't affected. But I think from our perspective, obviously the health and medical lifeline early on and continuing throughout the summer and the fall surge has been problematic and a challenge, across the state. I would say the second one would be food, water, and shelter. Early on from, grocery stores, their supply chain issues, making sure that shelves were full. We have a large poultry industry on the eastern shore of Maryland, and they were impacted like many other congregate type settings. They were impacted in the early months of COVID. And then also obviously the restaurant sector were very highly affected by COVID. And then I would say the third one really is safety and security, not only from the standpoint of that and the way we traditionally think about that lifeline, but really, people's social and safety nets were removed, and this impacted a number of sectors of society and had cascading impacts I don't think many of us really could have imagined at the start of this. So, I feel like over the course of a year, as emergency managers through our system, we've just been responding to the new cascading impact from COVID. And, it's certainly been a challenge, but, it's been one that we've been able to leverage our Maryland emergency management system effectively, both horizontally across state government. And Allegra will talk a little more in the second year about the private sector, which is absolutely critical throughout this. But we place such an emphasis on the role of the private sector that we have a functional area of non-governmental services. So in Maryland, we don't have the emergency support function and recovery support function. We have state coordinating functions that cross-cut all mission areas. I mean, one of them is non-governmental services that focuses exclusively on working with the private sector, nonprofits, and volunteers. So, Allegra, I'll defer to you to talk a little bit more in depth about the impacts of the private sector and, how you all effectively leveraged the associations, the volunteer communities to really do some incredible things. We coordinated bulk donations of international supplies early on, and it was a really, again, a whole community effort. So Allegra, I'll pass the baton over to you to talk a little more about the private sector integration piece.
Thank you, Kyle. So first and foremost, I commend all of our Maryland Private Sector Integration Program, private sector partners. At NEMA, the Maryland Emergency Management Agency, we have an engagement program opportunity for both private and public sector to liaise and to collaborate and to train and exercise together. And that's under the Private Sector Integration Program. And as the private sector liaison, my responsibility prior to any activation was to ensure collaboration and partnership with our Maryland private sector and to understand what their risks and vulnerabilities were in our state. So in order to build out our operational unit, which is the Maryland Business Emergency Operations Center under the non-governmental services state coordinating function. Because since the start of COVID, I've graduated to business engagement program manager, and I actually, that title has been more appropriate because, like I said, the private sector integration program is an engagement opportunity. And when we start engaging, just like every one of us engages in a relationship, personal, friendly, professional, you have to build and understand your audience, and you have to build trust. And within that trust, you understand, strengths and weaknesses. So to answer the first question, as my director established, we had impacts in all the categories of the lifelines that we mentioned. But more specifically, I want to talk about, that it says the question is the top 3 lifelines that been more accurately impacted. We have to consider that when the COVID pandemic hit, we were all scrambling for information. And so we were not only acquiring information nationally from our private sector partners and liaisons nationally, and our business emergency operations center managers nationally, and those of my colleagues of mine on this panel, but we were also trying to gather information globally, right? We weren't only being Maryland focused or nationally focused, but we were trying to leverage our connections, especially being in Maryland in the national capital region with our foreign partners. So we really acquired information from Italy and from United Kingdom so that we could potentially best plan ahead of time and understand what vulnerabilities they were having, especially in their supply chain, because they don't really follow the lifeline, but they follow more of the critical infrastructure and supply chain. So fatigue and the cascading events and keeping up to date with the evolving situation was the major challenges in health and medical, food, water, and shelter, and safety and security. And within that, there was obviously those more poignant problems. So health and medical, the lack of PPE and resources or available space that our medical facilities, privately sector owned, were having. So how can we support that? The same with the food, water, and shelter, the grocery supply chain, there was panic. Most Americans are used to natural events. And so natural events being tornadoes or tropical storms and doing panic purchasing. And so that created a whole hiccup in the supply chain. And then eventually there were outbreaks in the actual manufacturing of the meat industry and poultry. And so that created other economic impacts, that created other health impacts and safety. There needed to be euthanization of animals because that could have spread more diseases. And unfortunately, we were pulled too thin to deal with those cascading effects as well. And then the restaurant industry, we forget how much of that, the cash flow the restaurant industry provides into our economy. We get a paycheck at the end of maybe bi-weekly or every month, and we'd like to spend it on good food. And then that good food is then, that's spent, the food that the restaurant industry purchases has an impact, that cash flow has a supply chain impact. So it doesn't only go to the transportation industry, but the food production, manufacturing industry, et cetera, et cetera. And again, with the safety and security, our law enforcement personnel was pulled very thin to this day. I mean, being in the National Capital Region, having to deal with COVID, having to deal with elections, inauguration, and Capitol attacks, that has been such a hard reality that our law enforcement and our Maryland military and our National Guard had to face. And so how to provide support with these in this category from our private sector partners and vice versa. So the way Maryland did that was we activated the Maryland Business Emergency Operations Center, and our mission was provide accurate and transparent and real-time information as soon as possible. So that is what we did continuously. We started with information sharing through our virtual business operations center, where it was an initial repository of information of everything that was coming out from government, and where unfortunately our private sector partners were not able to find because there was overload of information. So we were trying to be a one-stop shop for them. We also provided situational report, which condensed the information and provided the bluff bottom line upfront information bi-weekly or twice a week. And then after we created the private-public partnership cross-sharing information calls, which initially were twice a week, now we've been conducting them once a week, where we have our state coordinating function from the public sector brief out all of the information that could be useful for the industries that they cater to. And then after, we have our private sector integration program members, our PSIP partners, which initially at the initial COVID pandemic, so January 2020, were 600 members, and now we've grown to over 1,000 as well. And so they were briefing out by industry, which we categorized through the Lifeline sector and the CISA critical infrastructure sector, to brief out by industry their success stories, their hiccups, and their supply chain issues, so that that information would go back to the state coordinating function representatives, who have a big weight in their department and agency. They worked directly with their secretaries to move forward policy and planning. So again, massive undertaking. There was a question about difficulty and what difficulties you encountered. Well, the difficulty was planning, right? Maryland is not like other states where we are impacted by a lot of disasters. Most of our threats are mostly targeted to our national capital regions, so cyber, potential active assailants, or terrorism. So we don't have a lot of natural disaster activations and holistic activations. Usually those are more focused in certain areas of Maryland. So being able to coordinate all of the agencies in a unified voice was a big challenge and a very big undertaking. But NEMA stood by its mission by providing clear set coordination and documentation and record keeping, right? Because at the end of the day, that record keeping would be a testament of how various task forces were working together. And then to ensure that the lifelines, I don't have the questions in front of me, but what were the most difficult lifelines to alleviate, and best practices of how you've alleviated the impact. Honestly, we always focused on equity within the lifeline. So our private sector partners are very important to us, and at all levels, small, medium, and large businesses. And so we ensured that the brief outs were provided by the associations that represented their industries, because we didn't want only one company to be briefing out their updates, but we wanted a holistic understanding of the industry and their problematics. Obviously, we welcomed the one-offs, but we wanted to ensure that we were reaching all equitable categories of the industry, like I said, small, medium, and large. And then we continue to hone in on what is the messaging that you guys are providing, both back in spring 2020 and now for vaccination 2021 to your populations, to your employees. What information can we be creating at the state level, at the government level, and what can we push down to the counties to best either educate your employees to ensure safety, to ensure more appease, less anxiety, et cetera. And so I would say that continuing with those open and transparent communication and collaborative calls has assured us to provide not only the necessary documentations, but we've partnered on talking points, on potential, not on potential, on FAQs, on, I forget what the terminology, but basically visual, not commercials, but basically public announcements. And so we partnered with the Grocers Association, with the Delmarva Poultry on all of these efforts, and they were crucial. And then I would say lastly, the number, and we ensured that we covered the languages of our population within Maryland, and we provided documentation in the variety of languages to, and we were collectively collaborating to understand, like, how are your employees, or even the family members of your employees, intaking and digesting this information? Is it only through technology? Is it through other measures? Do we have to do the public announcements on our, on our big billboards on our highways, or the billboards that we're not using for our stadiums, or through radio, television, and news? And so we really focused on that. And lastly, the question is, what resources have been utilized to help the private sector, and what are areas that we can improve on? The private sector integration program, emergency management has been working towards integrating the private sector and bringing them to the table for planning and exercise. But at the end of the day, it has been a slow uphill approach. It has been an uphill approach, but very, very slow. And the reason being is because of distrust. And the reason being is also because public sector might assume that private sector, having the capital, might have all the answers. But you can have all the capital you want, but if you don't know how to play the game, you don't know how to invest that money, or how to invest your resources and capability. So I don't want to belabor on gaming, because I don't, this is a national panel. But what I'm saying is, if you don't bring individuals and stakeholders to the table in your planning process, in your risk assessments at the state level, at the county level, if you don't have the private sector liaise, build partnerships with your local OEMs, they're never going to understand where they can help out, or how they can help out, or even what their risks and vulnerabilities are, because they think with a capitalistic approach. How do I make more money? How do I not lose my money? Well, a lot of times we're talking about risks, and how risks have a huge economic impact on our society. So I would say, without further ado, I'm going to pass it on to my other great colleagues. So Abby spoke, and now Persia is about to speak. But I would just say, we have opportunities for the private sector, but we're not being backed up federally with appropriate resources. We don't have enough funding for these programs that exist at the state level, or through our Business Emergency Operations Center, to staff our units appropriately and adequately. I mean, now most of us have more than 1,000 members, and to keep that relationship going and that one-on-one personable conversations is impossible with a one-man show. We have the whole BRIC movement through mitigation is a great opportunity to integrate the private sector in resiliency, right? In retrofitting our grids and how we urbanize our cities. But how can you do that if you don't have relationships prior? And again, resourcing and staffing and providing the adequate funds to get that technology to assist with that is necessary. And so I would say that my last point is, it's actually a call to action. This is a NEMA panel, and this is an opportunity just to say, maybe this is an area that NEMA can advocate to provide more funding to us at the state level to assist with private sector planning, so we can do more training and integration and exercise, so that the next go round when we have an activation, we're not asking them for help, but they're already integrated in our plans and we know where their efforts can be used or not. So I'll stop there. Thank you very much.
Thank you, Allegra. Okay, Persia.
Well, hey, everybody. First, I want to just give a nod to the Louisiana BEOC. They would have been the first BEOC, John, but we're proud to be the first operational, meaning that we are really, what we do is act as a conduit for the private sector, allowing them to fully be incorporated into the state EOC and be part of the response and part of the recovery, and really just have a way to fit in with all of those operations. To our questions, though, the big three impacted lifelines for us were healthcare, like everyone has said early in the game, especially supply shortages for PPE and so forth. And I want to say that the interesting thing is, and I think my colleagues here have seen it in their states, and that is that our small businesses really rose to the challenge. People that would normally be doing something else, like the North Carolina Brewers Guild, I'm thinking about them. I guess I'm thinking about that because Trina's in Kentucky, and the whole bourbon comment that came off earlier today started making hand sanitizers and things like that. So, and other things. So small business, some medium, having the ability to pivot and stretch has really kind of increased everyone's resiliency, I think, across the board. And so I want to make that comment on the healthcare front because, Research Triangle Park is here. There are a lot of folks that have been making PPE and making it from home. So I guess the lesson of having overseas suppliers and being so dependent on them, I know isn't lost on anyone here. So the other thing that we did, this is the Home Lab Corps. I mentioned RTP. All of you know that they've been under a great amount of pressure. I speak to them routinely. We have a good relationship, very solid partnership. Because we train routinely with our partners, we exercise a lot. Those relationships in general, they were already there and have been made so much stronger here. So throughout this crisis, those relationships over and over, I've been reminded of how crucial they have been. And I think, to all of the private partnerships here that have been able to reach out, looking for things that we never thought we would need, searching for things because it was a surprise to all of us, as John has mentioned, that we never thought that we would be looking for. So schools, I think, was mentioned. That was our other big impact. It is not a lifeline, I guess, technically, other than it's community service or community advantage. That's what I tell my children anyway. But in North Carolina, the big challenge and limitation for us was broadband internet, especially for our rural kids and teachers trying to do virtual school and stay connected. Thankfully, we had partners like Google who did amazing things to support, partnered with counties, outfitted buses, transported those buses into mobile Wi-Fi hotspots, expanding the reach of teachers, reception of students. So this solution really amplified and brought to us, I think, home a gap that had been there, but that this needs to be more of a permanent solution, that broadband and real access to folks that are living out in the rural areas. We've got to do so much more about that because their children may have now we know have at least another 10 weeks potentially in virtual school. And these kids are trying very hard to be connected. The other area would be food that was mentioned. So initially for us, food, the food supply chain. And as COVID spread throughout our packing plants, processing plants, impacting our farmers and growers, the folks that harvest for us, especially with the large numbers of migrant guest workers that we have, was a huge change for us, because to me, it's kind of like electricity, the entire food chain is kind of quiet. You never hear from them generally, but turkey and poultry, I think that was mentioned by Marilyn, our hog farms began to really feel the effects and weren't able to keep up with normal production as their workforce was dramatically impacted. So what had to be done? Well, of course, testing and contract tracing, infectious control protocols had to be put in place immediately. And we did that to try to help that industry. But also, Director Sprayberry, my boss, he established a food task force. So we could watch all of those areas and elements along the food chain from those impacted, from farmers and growers to the distributors, folks that were in the last mile, all the way down to the consumer level, as well as, and that's the consumer line, as well as the commercial chain, because we know the food chains have two. School lunches that were being impacted, well, not school lunches, but kids that still needed lunch from school, food banks, community grocery. So talking to our farmers and growers in that format, allowing them to come in and talk to us and tell us what they thought they could do, what they thought that we could do, talking to the food banks. Everyone is involved in that conversation. And I think that it was a huge step. And as far as hearing everybody, especially people that you don't always think about. We spoke to the fisheries, and as much as I do love fish, especially catfish, I rarely got a chance to really speak to the fisheries, and they were voicing problems that I don't think we would have understood without them coming and telling us about the folks, how badly they depended on the folks that packed that shrimp and packed that crab, and how those folks were going to be impacted, and the living conditions in a lot of cases of our migrant and guest workers, and how those conditions were just adding to the spread. So having a voice, I think, with the private sector, and understanding at the level that we had to, what those challenges were going to be, especially with bringing food to table. I felt like I got a huge education, and I began to understand why, as we all saw, that there was quite a bit of waste. We said it was waste. We didn't understand why. You guys know what I'm talking about: milk being poured out and fields being plowed under. But understanding that there were two food supply chains, and commercial and consumer. And since we were now trying to grab all of the supply we had and shove it down the consumer supply chain, that there was going to be bottlenecks and there was going to be problems. So I think that a good thing that happened out of the director's food task force is we got to talk to those guys about, okay, what can we do? What can you guys do? How can we help in the repackaging of now commercial food to make it available to consumers and to people that really still continue to need it, like our school kids, like the food banks. What else can we do? How can we mitigate the cost of them doing that? Or how can they mitigate their losses that they were already having? So those conversations built, I think, new relationships. Now I know the Fishers and others that I didn't. And I want to pause there, but I just want to mention that, so that we are kind of going down a path that I think where we're gonna arrive, that lifelines are the private sector, and the private sector is lifelines. So other than security, under security, we know that includes government, emergency services, community safety, and transportation, which of course includes roadways, and the public health aspect, which is under health and medical. Really, the majority of all of the components that we see in the lifelines are largely owned and operated by private sector entities. So we know that these relationships, and that these partnerships and programs that are represented here are critical, not only for the pandemic, but prior to the pandemic. And I think that all of us have benefited from that, to be able to turn to those partners for solutions, suggestions, better understanding their business, and better understanding, what government, local and state and federal can do. And my last comment is that, and I know Abby and I have discussed this in the past, that this pandemic And although this isn't exactly this isn't a lifeline, this challenge this year that we have all had to do with these layered events. Yes, the pandemic is going on, but hurricane season still came, and civil unrest still came, and wildfires still happened. And, you know, those challenges, the election, that whole thing, the civil unrest. So, you know, we needed to look at everything through this COVID, you know, kind of a lens, and create programs that didn't exist before in order to operate in this strange lane. For us, and it totally took over my time, and just I was obsessed with this, trying to create a way to keep people safe. In my case, during hurricane season, where we do sheltering of folks, especially our coast, routinely evacuating, as John will know. And how do we keep those people safe? If we can't use mass sheltering, if we're adding to the spread by doing that. And so suddenly, you know, we had a need to build this program. And although we were fortunate, about over 250, about 270 hotels joined us to try to help us with that, we had to create a program behind the way we respond in COVID, following the guidelines. So just doing this dance, chasing the rabbit, as we say down here in North Carolina, to figure out how to negotiate that. We've learned a lot, and I'm sure my colleagues here can speak to it as well. But through all of that, these relationships with those hotels and the others that we've built, like with the folks that are now making hand sanitizer that maybe weren't involved with response, recovery, or mitigation, and now want to be involved in emergency management, private sector, you know, that's going to build us resilience in the end, I think. And I don't think the importance of what, you know, everybody on this panel is doing, I don't think the importance of that, I don't think it could be overstated. I mean, the relationships with private sector, if it means we're going to move further, whether it's critical infrastructure or an infrastructure that, or I should say an infrastructure or an entity that can become critical, like grocery. Who would have called them a critical infrastructure before now? Well, now they are. So, but these folks here on this panel and those relationships that are connected to these people, you know, we get solutions, and I think we get things done. And I think the private sector is willing to work with us on that. So I'm going to stop, and I'm just glad to be, you know, here with y'all.
Well, great, Persia. Thank you. And thank you all y'all for giving your thoughts and perspectives on this. Do we have any questions at this point? While we're waiting, I do want to ask another question. I really want to ask this of Abby, if I can. Abby, homelessness, that has increased across the whole country. I'm sure y'all are dealing with that in California. Is there anything that y'all are doing to try to alleviate that severe impact? And with that, a double question to that, is there anything that you're using from the private sector partners that are helping you with homelessness and treating those individuals?
Yes, that's a short answer. But yeah, homelessness is a huge problem. It is a problem across the country, but it is definitely a problem here in California, and really a lot in Southern California, which, if you remember that map you showed earlier, all those dark spots, that's where it is. And so we had several programs that we set up that were really innovative and exciting with the private sector. The first one was called Project Room Key. And basically what we did was we, I don't know, in most cases we rented out hotels, and in some cases we actually just bought the hotels. And with our funds with the counties in California, there's 58 counties, with those counties, we're be able to use these rooms as a location for the homeless population to go and, you know, if they were infected, or if they were exposed, or if they were especially vulnerable, they were able to go there and have themselves a room. at these hotels in order to keep them safe and keep them healthy. That project was very successful, and it did incorporate a lot of the coordination with our private sector partners. It was kind of a solution for some of our tourism industry issues. We also created a program called Great Plates Delivered, which was kind of cool, that it kind of attached to the homeless program of Project Roomkey, but also to our larger vulnerable population, the seniors and those that cannot get out and about. Basically, what we did was we partnered with restaurants, local restaurants throughout the communities, through our counties and our cities, and we're able to pay for meals, healthy meals for these individuals through that program. And we paid the local restaurants to make and deliver these food. So it was a win-win for everyone there. And then our Project Room Key turned into Project Home Key, which I believe, and don't quote me on this, but I think we're using CBGB funds, but I'm not sure where that funding has come from. But we actually are turning some of those rooms into little mini homes for the homeless community as transitional housing to get them back into society. So those are some of the things that we've done right now. One of the projects I'm working on is the vaccination effort. And how do you vaccinate some of our more vulnerable population that happens to be unhoused? And so it is, because one thing, you got to get them to a location to get the vaccine. You got to get them to trust the location to get the vaccine. And then you have to make an appointment for them to come back either 21 or 28 days later to get that second vaccine. So it's not the easiest thing in the world. And so coordinating with a lot of our counties and our cities on that effort. So yeah, it is the absolute biggest problem. I did want to add on to what Persia and Allegra had said previously about the cascading events. We've all dealt with cascading events this year, and we have all needed additional support and could use additional support, because I'm sure I'm not the first to say it, and I won't be the last, but I'm tired. I mean, there's just, I'm really tired. We counted it up. Our state operations center as of today has been activated for 366 days straight. It is just insane what we are having to do and the things we're having to deal with that we never were. This is not what we do. Give me a fire any day than trying to figure out how to decide who gets vaccinated, where they get vaccinated in partnership with our public health. And it's an absolute mess. And across the board, not just, I mean, because of the priority and the lack of the actual vaccine. And so there's a lot of support that we could get that would clearly help us. And I do believe that this pandemic has, if it's shown us anything, it has proven FEMA's mentality of the whole community. Every single person was affected. Every single person is tired. Every single person has mental and social and relationship concerns, every single person in their own way. And so we're all in this together. So it's kind of one of those things that any kind of support that we can have would be exceptional. So that's me. I'll get off my soapbox.
No, that's fantastic. That's great to hear those programs. I think Liz had a question, if I'm seeing this right. Maybe it's more of a statement. Let me ask another question, if I can, for any of y'all. Looking at the lifelines and looking at the impacts that you've seen, what has been your latest and greatest partnership that you've established during this event that has been a success factor for you in dealing with COVID with your lifelines? I heard a space one. We talked about the space one. Are there others that maybe are good best practices that might be some partners? Kyle, you're shaking your head. You got a thought on that?
Yeah, I'll jump in on this one. You know, I think things that to Abby's point, to think we are all tired. We've had quite the year, but we couldn't have done this without those partnerships. So, in Maryland, Allegra and her team developed a really strong relationships, not only with individual businesses, but the trade associations who can amplify our messaging in a really effective and efficient manner. And, she's been, and she could talk a little more about this, she's been effective at getting these associations to the table and hearing their specific sector concerns. But really, I think kind of the broader point about what this year showed us, not only the COVID response, but really our way out of this is got to be investment in resilience. My boss, Russ Strickland, likes to say mitigation is the center of the universe. And it certainly is. And, the way we're going to make substantial change and an indent in future disasters is really through investment in resilience. And it's going to take the partnerships that we established over the last year through COVID with the private sector, with the associations, like was mentioned earlier, that most of the lifelines are owned by the private sector. So we need to be partnering and leveraging everything we went through over the last year and those groups to make a dent for future disasters. I think it's like, Abby said, we know how to do fires. I was thinking anecdotally, we had Tropical Storm Isaias in the middle of this, and it felt refreshing because it made sense and was linear. So, but I think really we're as climate change takes hold in the country and around the world, we're going to see more acute atypical incidents that emergency managers are going to be asked to lead. And the only way to stop that is to invest and build on the partnerships that we've made over the last year with the private sector.
Hey,
But,
John,
yeah.
I'm gonna jump in on a best practice. It's something that I started doing this pandemic, and I had hoped to do it before this, but there's always some new thing to work on. And we've been doing something that we call it sector analysis here. And so what happens is our private partners, and this is absolutely because of the relationships we have, give us input every day. We're talking about private partners that are in the sectors that are under those lifelines, every day giving us input about their sector. So they are analyzing what are the challenges, what's coming over the horizon, what do we anticipate as being a problem? And they don't have to give us their names. They don't have to give us their company names, but they're speaking to the sector. And the wonderful thing is that information is coming through to the BEOC, and we're rolling that up to the director, and he's briefing the governor on that. That's part of his COVID briefing every day. So the partners are able to signal that this is what's coming, this is what we need, this is going to cause a gap, because as we said before, the pandemic has been a surprise. How many times, I know that I've said at my house, how many times we're surprised by something that was impacted by the pandemic that we never would have expected. And so the private partners have been keying us in on things that are very, very particular to their sector, their business, things that we couldn't know that may have a lasting impact or dramatic negative impact on the communities where they live and they work and they service those communities, and on the state. And they're able to tell us ahead of time, if this becomes a problem, this effect is going to happen. And the wonderful thing is, it means that the responders at the state and county level, as well as the governor in this case, since he's hearing that every day, can get a heads up as to what certain decisions may mean, or how it may negatively impact those private partners in those industries that are trying also to survive during the pandemic. So that's my that's, I would say, is a best practice, at least for our BEOC. So we call it sector analysis. It is a reporting that I don't think could happen if those relationships are not trusted enough that they will tell you that, hey, in the event this happens, this is going to be the outcome. So hearing from, for instance, the groups through the restaurant sector saying, we can hold on for 3 more months, and then we're going to start closing our doors because we don't have a choice. and we anticipate this percentage of loss in the sector. That kind of thing before the newspapers or anyone else tells you, or some healthcare provider, which we've had this, call and say, you know, we got this problem. We can see it coming in healthcare because people aren't doing their, screenings for whatever disease, and we can see this. So we were kind of getting this input, which was able to drive, in some cases, public messaging or decision making. So I just wanted to put that out there. So that's something that we've been doing that's turned out to be quite a good thing on both sides.
Great, thank you, Persia.
John, I don't know if you wanted me to provide some examples on some of our partnerships in regards to isolating individuals that had contacted COVID in the poultry industry. Most of the individuals come from ethnic minority groups and vulnerable populations. And so they were hesitant to isolate themselves from their family because of the uncertainty they had that government was coming in and saying, you have to remove yourself so that you're not infecting the rest of your family. So what we did to support that is that we got with various private sector companies, Charter Up, which is basically a tech firm that with data can pull which motor coach companies are available and can provide assistance for transportation. But we were trying to think proactively on how to create tag mobile homes. And there was also a Maryland Mobile Home Association that we engaged with as well, so that we could put those mobile homes outside or in the vicinity of the individual's home so that they wouldn't necessarily feel like they were being transported to another location. And we were trying to leverage the lodging association with our hotels and lodging industry, but unfortunately we encountered those obstacles because of the population we were servicing. Another example is the relationship we had with our Maryland Retail Association. So they work with all the grocery retails, and what was happening was panic purchasing, and there unfortunately they decided to ensure that individuals, when going to grocery shop, they weren't over purchasing and they were counting items. So that inhibited our child care group our child care were open to help essential employees to purchase in bulk, and that inhibited our group homes to buy in bulk as well. And that was impacting all of our social services program through our Department of Human Services. And so what we did is we partnered with the Retail Association to understand to get us a letter from the grocery stores and the corporations of the grocery stores, basically allowing these individuals to over purchase in bulk. Same happened with our partnership with the Beverage Association. There were companies like Coca-Cola that wanted to, that invested in supporting manufacturers that had retrofitted their businesses in producing personal protective equipment. And one of them produced locally manufactured face shields. So through the Coca-Cola financial donation, this company and manufacturer was able to produce face shields that then was transported by the Coca-Cola Manufacturing Association to our donation collecting sites, which then was redistributed to our hospitals and our essential worker locations. And I'll stop there.
Well, that's great. So let me ask a question that we did get. One of the questions I'll ask to the group as a whole, because of COVID and the COVID concern, let the participants know if y'all worked from home, if y'all were remotely activated, and if you were, did that have an adverse impact to y'all's response?
I can start. Yes and no. There's my answer. So yes, when COVID started, we slowly but surely went virtual. It was more of a hybrid model. Some of us were in the office and some of us were virtual, and it was okay. Then it got worse and worse. COVID got worse and worse, and there were more and more virtual activations. For my BOC, the business operations, we always do things virtually anyway. And so it was very nice because Sacramento is, we're not the center of industry in California. We're not San Francisco. We're not Los Angeles. We're quite a ways away. And so I don't expect any of our partners to want to come in and work with us in the state operations center. They're more than welcome to, but it'd be quite boring for them, really. I'd rather have them where they have their resources. And so we do that virtually anyway. And so it's very helpful in that respect. The other question that I saw come through, I'll just answer that right quick, is that about we had the cascading events. And it really depended on how big the event was as to whether or not we would stand up another incident management team within the state operations center. On most respects, it would all be under COVID, and therefore we'd have COVID/fires, COVID/civil unrest. We also have a situation cell that is implanted in our operations center that does everything, including our public safety power shutoff threats and concerns. And so it's unfortunate because for some of us, like myself, and I would imagine Persia and Allegra, we did it all. There wasn't anybody else to tap and say, hey, can you do this? Right now, I am knee deep in COVID and vaccine coordination. And I have my deputy that I am keeping as far away from this as possible, because if something were to happen tomorrow, I need him to be able to step in and do that because I can't back out of this. So there is that concern. But to answer the questions, yes, virtual was great for us. It was helpful to have some people here in the offices to be able to communicate quickly, but to be able to communicate virtually with the rest of the team what was very helpful.
Great points. How about y'all, Persia?
We responded to Hurricane Isaias. That was in August, and everybody was nervous, I think, about it, because coming into the EOC in North Carolina, and our BEOC is inside, especially not just for the private sector, but for all of the state emergency response team, all the agencies and everyone coming into the state emergency response center. It's a big deal. I mean, we have had 350 people there for things. So the private sector always comes. They can hang out with us for the duration every day, however long, and they're welcome to be there. A lot of face-to-face coordination happens there across the members. I mean, between DOD and Highway Patrol, National Guard, Commerce, Ag. I mean, gosh, infrastructure plans, logistics. Our private partners pretty much walk everywhere, wherever they want to go. For EZAS, I think there was 4 people, 4 or 3 at the state EOC. And we were nervous about this thing coming in, but we ended up very successful with it. It was our first fully virtual response to a hurricane. I think that the key for us was we use WebEOC pretty extensively. Our private partners have access to WebEOC. So switching to that format and then having briefings through, we use WebEx, and including meetings and coordination calls, operational calls to the private sector over WebEx, because we were able to do that. So we call it a success. We think that it worked very well. As that hurricane was leaving, there was a tornado that spun off. So we also got to do some non-congregate sheltering operations with the hotel group that had just jumped on. So it was a challenge, but we're glad that we were able to successfully do it. Regarding the multi-layer or mini events, someone was asking about that. We were kind of toggling between the civil unrest because it was popping up all the time. It wasn't any one event. It was popping up all the time. And we were activated, of course, for the election. So recovery for EZAS and civil unrest that was happening. And that was, I guess, that was from the Black Lives Matter movement. And then moving into the election. For us, it was multiple events in WebEOC, and everybody was able to just change events and stay focused on one event at a time, but you were toggling all the time. So it was sort of like, it was kind of like the Beyonce dance, but just not as happy. You know, that's a good way, I think, to describe it.
Thank you, Percy. About Kyle.
Yeah, we had similar experiences. So, you know, initially we were 75 to 80% in person, about March until May. And I think it's a decision we struggled with, given obviously it was a contagious virus that spreads, but the complexity and the acuity of the situation was really such that face-to-face coordination was really critically important in the early months of COVID for us. We slowly over time got people out of there, broke off units, broke off sections and moved them virtually. By the summer, we were 100% virtual. And we've been in 100% virtual for COVID until about a couple weeks, 2 weeks or so ago, just because of the complexity of the situation with mass vaccination and the rollout of that has necessitated a little more in-person interaction. Obviously, knowing what we know now, we're doing that safely and in a distanced manner. But we probably have still, I would say, 300 people working on this every day, and maybe, you know, a dozen people in the State Emergency Operations Center. And, you know, to the gift that Persia sent us, which was Isaias, you know, we were equally nervous as well in Maryland. We had about 3 people in person. I spent most of my time doing live interviews from my living room. So that was certainly a change. But, you know, again, I think that what we learned in the early months and the redundancy and experience we got with the early response really paid dividends. And if you think about Maryland, we had several really severe winter storms. We had the election, we had the insurrection, and then all of the one-off events that were mainly, you know, handled by either, you know, sector agencies with responsibility or our duty officer, director on call cadre. So, you know, I think we've learned a lot, and we've learned that we can do a lot more virtual, but I think there is still always going to be, as the complexity of the incident increases, it just really necessitates some degree of in-person collaboration. And, you know, I think, you know, all the companies across the world are feeling that too, that, you know, it's hard to replace the interaction of in-person, but we've done it successfully.
Very cool. Allegra, do you have any comment on that, or?
I think Kyle summed it up very nicely.
Great. Well, we've got about 3 or 4 more minutes. Let me just ask, is there anything that you want to share, any final word of wisdom to a state that may be going through I'm sure they're going through the same issues you are. Any nuggets of gold that you want to throw at them? And also, for those on the call, we're throwing up one more question for you to do the poll with. So if you'll do that real quick, but yeah. Abby, why don't you start?
I would love to start. So my nugget of wisdom that I would love to share with other state directors and our sister states. First of all, before I say this, during this pandemic, our fellow private sector liaisons have become very, very close, and we rely on each other very heavily. And so I think it's very important for states to at least have someone identified that can be that point, because I call on Persia and Allegra, I call on just all of everyone all the time over in Virginia, up in Washington, to ask questions. What do you think about this, or how do you think about that? And it's just so valuable to have all of the different state perspectives coming in to talk about it. But what I would like to say, my nugget of wisdom would be to really value the private sector and the private sector relationships, because, you know, in California for the longest time, our private sector liaison was buried in ICS, was just down at the bottom of the list. and under logistics, and it was all about resources. And Governor Brown at the time, and now Governor Newsom, and then our Director Ghilarducci, thought that they needed to have a better seat at the table. And so they kept elevating the position. And so now the reason that I can get as much done as I can is because I do have a position of authority, and I do have a voice and a seat at the table when decisions are making. And that means the world to the private sector, because it shows them how much you value their input. And so by having those individual people designed for that relationship is so important, but also giving them some kind of a authority and presence, and letting the private sector know just how much you value them by putting them at the table with you, and having that person there. So that would be my nugget of wisdom, because in California, our relationships have changed and grown so much over the past 10 years because of that development.
Great, thank you, Abby. Allegra?
So Abby's completely right. And, we need to integrate private sector really into the emergency management system. And the only way to do that is to restructure of how we think about them, and giving them like I said before, a place at the table. And so we need to identify nationally also a reporting structure. So even at NEMA, we need to have a voice for integrating the private sector to not only sell us their capabilities, but to inform us what their vulnerabilities are, and to discuss with us on a panel how they worked with each state, and how their success stories were, and what their methods of reporting, what they would like to see at the state and county level in order for them to have better successful operations as well to support us in emergency response. So I'll leave it to Kyle to elaborate as well.
Yeah, so the genesis of our program, so Maryland's a small state. We have $8 million disasters, and the private sector is nominally impacted by that. So our program started as an outreach component to provide information to the private sector. And what we've seen over the last year is how it's really grown into much more than that. It's grown into a collegial relationship with the private sector, who again has 85% of our critical infrastructure, and really speaks to the importance of integrating not only them, also nonprofits and volunteer organizations who are not government into the emergency management system. What we saw was the emergency management system broke. It was the first time that all 56 states and territories were activated at the same time. We couldn't help each other as government. We needed to look to other areas for assistance. So, I think it speaks to the need to for states to fund these kinds of programs and really invest in them. Like I mentioned earlier, it's all about resilience, and we're going to be investing in the private sector program, not only for consequence management, but for disaster risk reduction and working together as partners.
Thank you, Kyle. Persia, we'll give you the last words.
Oh gosh, there's so much to say. I think that I think that my colleagues have summed it up really well. If I could say anything, I think it would be that I think we need to really look as government. We really need to look at the private sector as a partner. They are a partner, just like we look at other state agencies or other entities. They are a partner, and if we treat them like partners with the kind of trust and respect and the work involved to build that trust and respect, I think that we can solve a lot more problems together. I think collaboration and all these other things people talk about would be a lot easier. Whatever program you're trying to build, or whatever area you're trying to go into and expand, and you want to pull the private sector in, I think you have to start with those building blocks. So building a trust and building a relationship, you've got to really make them partners. So and that's going to lead to things that are natural, like training together is going to be natural. having them in the EOC will be normal. I mean, and facing something like a pandemic, that's what we need. That's what we need. So, and beyond this, you know, the so-called normal that's coming. I mean, and I want to mention this because I don't know if it's on anybody's mind, but the things that Texas just recently endured with their winter storm. I mean, they to have those strong partnerships. I mean, they really, really need them now, and you know, and I hope they have them. And you know, any of my colleagues here, we'd help them to get those. But these are, you know, that's not the time to look for partnering. You know, we have to do it in blue skies, of course.
Well, thank you, Persia. Thank you, all of y'all, Kyle and Allegra and Abby. I know y'all got so many other things y'all need to be doing right now, but I will just say all that you've shared helps everybody in the country at the county level and at the state level better understand how to do these things. And what y'all have done with the private sector is amazing. So with that being said, Jess, I'll turn it back over to you.
Thank you, John, and thank you to all the speakers. You guys were phenomenal, which we knew you would be, but I also would like to applaud you, John, and your AECOM team for doing this and for hosting this. This was a fantastic session and a great way to kick off our virtual lab. So thank you.